So these are the points that are given in there are two types of Ramsay sedation score. Okay, one is the older version of Ramsay sedation score where you have the, just make it full screen for me. So this older version is one where you had that 6 levels or 6 classifications of scoring. And in the first one, the patient is anxious, agitated, and restless. Patient cooperative, oriented, and tranquil in the second level. So this is supposed to be the ideal condition. Patient should be cooperative, very oriented, and able to answer all your questions and be calm, so that the sedation is optimal to keep the patient calm, at the same time reply to all your questions and able to tell you what is happening. After 3, 4, it becomes little more deeper. The sedation becomes more heavier. The patient responds only to commands. Then the patient responds to light lamellar tap or auditory stimuli. That is, you have to increase your voice or tone to get a response from the patient. And 5 and 6 are much more deeper sedation, sluggish response to light lamellar touch or auditory stimulus, and no patient response to lamellar tap or auditory stimulus, which is a almost stage of coma or very deep sedation. This was modified little later by adding 2 more levels. So the first one remained the same, awake, alert, minimal or no cognitive impairment. The second one is the same as the previous one, where the patient is awake and tranquil, purposeful response to verbal command. Then in the third, it appears asleep, purposeful responses are there to verbal commands at conversational level. You may not shout or raise your voice here. And 4 appears asleep, purposeful responses to verbal commands are there, but louder than usual conversation level is required. And even you have to tap the glabella and get a response for that also. And 5, it is almost like the earlier one, where the purposeful response is only to loud verbal commands. So here the difference between here, the auditory stimulus, the quality of the voice that you have to make is not mentioned in this. So here it gives sluggish response to auditory stimulus. So in this modified Ramsay sedation score, if you see, initially the level of voice or the command that we make is like a usual conversation. You may not have to shout or raise your tone or voice to communicate with the patient. But in the 5 and 6, you can see that there is a required for loud verbal commands. So you have to go for a louder voice to get a response from the patient. And in the 6th level, it was earlier, the original Ramsay was a comatose stage or a very deep sedation. Here there is a response to painful stimuli that is included in the modified Ramsay score. And in the 7, the patient is asleep. There is only a reflex withdrawal to painful stimuli, no purposeful response. And the last one, unresponsive. So the what was in the 6th category or 6th level in the earlier Ramsay sedation now has been pushed to the 8th level. So 2 more levels have been added to distinguish, especially in the ICU. The patients are initially sedated and ventilated, and then when you want to wean off the sedation, these extra 2 categories and the modification done help you to assess the patient's consciousness as well as orientation much better. Now, Ramsay and his colleagues, they designed almost 30 years ago to measure the sedation for intraoperative purpose. This is the first one, as I told you, they used it for intraoperative sedation. And they made 3 levels for awake state and 3 levels for sleep state when they were using it for sedating the patients undergoing surgery under regional technique. And then this scale became a standard method for assessing and comparing the efficacy of sedation drugs in the ICU also. And it was developed, which was originally developed for intraoperative sedation. And it is criticized severely for lack of clear discrimination and specific descriptions to differentiate between various levels of scale. And that is the reason why this Ramsay sedation score has been modified into the two more levels, and to get out of this particular criticism that this is not a very clear-cut distinction or differentiating scale for assessing the sedation in patients. And it was one of the critical psychomotor properties of a good scale that this levels of scale deal with only one variable. So if you see in the first category earlier, it gives the patient is awake, but he is either agitated or calm. So all the variables are given. So that should not be the quality of a good scale to assess. It should say patient is calm or agitated. Agitated should come as a second level. So combining two or three variables in the same level, that is the one which confuses the assessment of sedation, and that is the reason why they criticize that. And patients easily can present clinically in a more than one category when you use this scale. For example, a patient could be asleep and arousable to voice, which is coming under level 4, but intermittently be agitated and restless. So this sort of things can happen in the ICU, which means he will come under category 1 or level 1. So this sort of intermittent confusing states can happen, and this occurs because some of the levels of scale include different terms. One level has anxiety and agitation, and another level has orientation, cooperative behavior, and another one saying patient is asleep. So this sort of variable behavior included in the same level makes it difficult to exactly differentiate the level of sedation in this scale. So in spite of the criticisms, because this was very useful as a very simple guide to go ahead and assess the level of sedation, even though it has its limitation, it is used as the gold standard for assessing the sedation, especially in critical care units. And the Ramsay scale is used as a reference scale or a gold standard against which sedation assessment scales are tested for validity. Okay, that is the 2 points you can add to your answer. Coming to high altitude